The COVID-19 pandemic left many patients without access to the healthcare they need. Students and faculty at Emory and Morehouse Schools of Medicine recognized this gap in care and partnered with Grady's Department of Strategy and Population Health to create a proactive outreach telehealth initiative for the most high-risk patients for morbidity and mortality from COVID-19. Students used telehealth to screen for and educate patients about COVID-19, check on medical conditions, facilitate medication refills, and screen for social needs. Through this outreach initiative, 1,461 patients have been called so far, including our patient, Miss S. Miss S is a 65-year-old female with a history of epilepsy, multiple intracranial hemorrhages, uncontrolled hypertension, and bipolar disorder. She was last seen in the emergency department in January for hypertensive urgency, but missed her primary care follow-up appointment. Through the student-led telehealth initiative, she was identified as high risk due to her chronic conditions and called by a medical student on May 21, 2020. On the call with the medical student, she was difficult to understand and confused about which medications she was taking. On request, her son took her blood pressure, which read 200 over 145. She denied experiencing any headache, vision change, or shortness of breath at that time. The student recommended taking Miss S to the emergency department if she appeared not at her baseline, but the son was hesitant because of COVID-19. The student was concerned for hypertensive urgency versus emergency due to Miss S's mental status and consulted a physician advisor for referral to the Mobile Integrated Health Unit. The MIH unit is comprised of an EMS paramedic and family nurse practitioner to provide home visits to high-risk patients. At the MIH visit, Miss S was tachycardic, short of breath, and unable to get into bed on her own. She was unaware of which medications she took and had duplicate bottles of varying dosages. MIH educated the patient on her medication regimen, organized her pills, contacted social work for home health and meal assistance, and recommended urgent follow-up with MIH and a primary care provider. Miss S was a no-show to both follow-up appointments, and social work was unable to reach her throughout the month of June. In July, the medical student finally reached Miss S's son. He reported that the patient never answers her phone, and a recent blood pressure reading was 190 over 100. The student and son discussed the communication barrier, and the son agreed to assist in scheduling visits for Miss S. She was finally seen in the primary care clinic in July. Her blood pressure read 180 over 102. She was still confused about her medications and was difficult to understand. Additional concerns included a renal mass without follow-up and seizure disorder, for which she was taking only one of her 2 medications. The provider was concerned for severe cognitive impairment and insufficient social support. She was referred to home health for further medication assistance, MIH for a home safety evaluation, the memory clinic for cognitive assessment, neurology, and urology. The time it took for Miss S to be seen by the healthcare system is indicative of the added stress of the pandemic on an already overburdened health system. Once she was finally seen in clinic, Miss S's history of no-shows was illuminated as most likely related to her social situation and memory impairment. This case illustrates the importance of recognizing the multiple factors influencing patient adherence. This case also demonstrates the ability of telehealth to bridge the health system gaps accentuated by COVID-19. The use of telehealth allowed the hospital system to reach Miss S in her home, engage family members, and understand her barriers to care not obvious in the clinic. The role of the medical student was crucial in identifying and meeting the needs of this patient, proving the value of utilizing the health professional student, especially during times when healthcare personnel and resources are scarce. In summary, caring for Miss S required a medical student, primary care attending, nurse practitioner, social worker, and family members. Without this interdisciplinary team, she would not have received the comprehensive care she needed. This unique clinical vignette shares the impact of a student-led telehealth outreach initiative through an enlightening patient case during the COVID-19 pandemic.